Doctor, I just got diagnosed with breast cancer. They talking about giving me an option about mastectomy or lumpectomy.
Well, first, let me start by saying that it's natural to feel fearful when you're first diagnosed with this disease. You don't know much about it, and but I want you to be comfortable and know that your breast will be reconstructed and you will get your breast back. What's important now, between now and when you get that procedure done, is to learn as much as you can about the surgeries and about the different options that are available to you. And so you go through this process, which is as much information as possible. It's important for you to meet with your general surgeons and know what they plan to do, and also meet with a reconstructive surgeon, which will then explain what kind of procedures are available. And based on the information and based on the recommendation, then you can pick the procedure that best matches you and your breast and your desires. And just so you know, the options that are available are either with implants or using tissue from your own body. And so there's an implant-based reconstruction and autologous reconstruction. And they both have their pros and cons, which you'll learn about. Another important point to bring up is that as the technology is improving and as we have better surgeries, less invasive surgeries available to us, you should consider those and you should ask about those from your surgeons. For instance, the lumpectomy procedure that you mentioned earlier usually was done through an incision to the breast and would result in a divot, would result in a sort of a cavity. Whereas now lumpectomy can be performed through a breast reduction or a breast lift incision. So at the time of lumpectomy, one could consider doing a breast lift and remove the cancer at the same time in one stage, and the resulting aesthetics are going to be definitely better.
Doctor, if I decide to do mastectomy, what do you suggest? Which one is easier, to implant or my own tissue?
Okay. Well, that question depends a little bit on your preferences and special situation for each patient. Generally, using your own tissue, which is called autologous reconstruction, it has better outcome. The breast will feel more natural and perhaps even look more natural. The only downside to that, it usually requires performing surgery on other parts of the body to bring those tissues and skin to the breast. Whereas using implants, there is no other deformities, there are no other scars or incisions on the body. However, implant-based reconstruction usually is not as natural a result as an autologous reconstruction. And depending on the size of the breast and the nature of mastectomy, you can make those informed decisions that will match your particular condition. So by the way, I wanted to also mention that most of the reconstruction of the breast right now happens at the time of mastectomy, and I think that's a good idea because the outcomes are going to be more natural. The whole process may take several months. You may need revisions and touch-ups down the line, but those are really small steps. What's important for everyone who's diagnosed with breast cancer to know is that this is a disease that has very small mortality. Almost everyone with breast cancer will live, and this is a time for you to be strong and fight the cancer. And the options are there available to you for reconstruction, and you'll have your breast back. Just be strong and fight the fight against cancer.